Wellness for Life is brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.
Hello, I'm Dr. Gothenburg, and we're filming today in Pelican Rapids. I've had a clinic here for about 32 years. And what I wanted to do today was to handle a couple subjects. And the first one would be, what are some simple strategies for people with pain? In other words, someone has told you, or you've heard it on TV, does fish oil help with pain? And I want to tell you that it can be a strategy to help people with chronic pain. There are some differences. When we make a recommendation, you'll usually heard about fish oils. There are omega-3s and omega-6s. We try to pick a fish oil that is in a higher ratio. In other words, there is more omega-3s than omega-6s. So that is a good strategy. If you need information, contact us. The second thing is, if I were to go out and rake this afternoon, I might wake up tomorrow sore because I'm not used to using my muscles. And so when a muscle uses oxygen, one of the byproducts are certain irritants that tend to pool in the muscle. This is what makes us sore. One of them is lactic acid. So the strategy is that we can do things nutritionally. We can do nutritionally through supplementing. We can take supplements or a supplement that in a sense neutralizes or buffers that acidity. Thereby, we can do more with less pain. So the strategy can be carried even one step farther to, for example, a person who has chronic nerve pain. If those acid or irritants pool around the spinal column, they can cause just lingering pain. The one key factor is, when we work with a patient like this, usually in about a 2-week period, we ask that they eliminate sugar in their diet, and that is the really hard thing. Carbohydrates and sugar increase acidity, which increases nerve pain. If you have questions about this, we can certainly help answer those questions too. The second subject I'd like to handle today is the question I often hear, is it possible, doctor, do you think, is it possible I may have a rib out of place? And so the answer to that question, absolutely. And it's not a day that we don't go by in our clinic here that we don't find this as a contributing problem. So just to understand briefly, the rib attaches to the facet, which is a slight depression alongside of the spine. So usually the pain is about 3 thumb widths from the center of the spine. The pain is often very well localized. It's specific. It's easy for the person or the patient to put their finger on it. It's not uncommon. The pain may extend out underneath the shoulder blade, and in some cases continue all the way to the chest area. The solution is really quite simple for a chiropractor. Chiropractors have been trained on how to correct this misalignment. In our case here at our clinic, usually people can feel better sometimes within 2 to 4 hours. They might leave the clinic where we use a piece of kineso tape, a stretching type tape that holds that correction. As far as causes, I think one of the most common causes is posture. So people that are prone to working with their arms rolled forward, or if they're carrying something with their arms extended, that's really another common cause. As far as what do you do for prevention, in the upper back, there's not a lot of exercises, so we stress posture and flexibility through stretching. If you're having lingering pain between the shoulders that is sharp, well-defined, and not really responding to everyday adjustments, please give us a call.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.